Now, Fawzia Shafiq is head of the UNICEF Health Program. She is joining us live now on Skype from Sana'a in Yemen's capital. Thanks very much for being with us. So talk a little bit more about what the challenges are in Yemen in preventing and containing outbreaks like these.
Thank you. Some of it you captured already in what you said, but what is important to also note in that in the 2.5 years since the conflict began in Yemen, most of Yemen's public services systems have been collapsing and are now near total collapse. One of these is the water and sanitation system in the country that depends heavily on the availability of fuel and then of course on the presence of the water and sanitation workers in all the districts and governorates of the country. Now this system is unable to function because of lack of fuel in the country, but also because of the non-payment of operational costs for the various water treatment and sewage treatment systems in the country, and also because the workers that make these systems work have not been paid for several months in most of the country. And therefore, as you mentioned, water is usually the biggest source of spread of the disease, and in a country where more than half the people do not have access to safe water, the grounds were fertile for the disease to spread once it was introduced in the environment.
And as far as, I mean, the World Health Organization, for example, has approved the use of a vaccine in Yemen, but it works best if it's given before an outbreak starts. I mean, so what then does this specific situation require to stop what the UN is now calling the worst cholera outbreak in the world?
But the vaccine, as you rightly mentioned, is best used as a preventative measure. So in a country where you are expecting to see a cholera outbreak and the environment is not conducive to other preventive measures, use of cholera vaccine can be life-saving. Sometimes it is used as a response strategy as well, but the condition in Yemen at the moment is not appropriate for that. So what is needed in a place like Yemen is to have population that is aware of the threat, more importantly is aware of how to protect itself from getting the disease. So simple things like washing hands at the right time, storing water properly, treating water with chlorination and using that for household use. Making sure that if somebody does have diarrhea that is symptomatic of cholera, then they are taken to health facilities as soon as possible, that the oral rehydration salts are used as early after the symptoms begin as possible. So this would perhaps be the most important thing to do, which is why starting in another 10 days, UNICEF, World Health Organization, the health authorities and partners are starting a massive nationwide campaign that will have teams knocking on every single door in every house in Yemen, telling the families about how to protect themselves, also giving out ORS and zinc tablets wherever needed, should there be a case of diarrhea in the house that is being visited, and at the same time working on several water and sanitation projects to make sure that the environment is kept safe as well. And then of course you already made reference to the availability of health services, so the people who do get cholera are able to get treatment in a timely manner. What has been, in this dreading situation, what has been slightly positive is that most of the cases of cholera that we are seeing are mild to moderate, which means they can easily be treated just by simply giving oral rehydration salts. And that is why the partners have been working on opening several hundred oral rehydration corners in health facilities and in communities to make sure that the mild and moderate cases can be treated there. And then of course the 15% or less severe cases that we are seeing that are at the risk of losing their lives if they don't get treatment quickly need to be treated by at the diarrhea treatment centers, which have also been set up across the country.